DW Africa Link.
Every year, dozens of Nigerian children go unvaccinated, being left vulnerable to diseases the world has long learned how to prevent. Behind the statistics are real lives, children in remote villages, overwhelmed clinics, and parents caught between misinformation and broken systems. So, what's holding back one of the most powerful tools in modern medicine? And why in 2025 are so many still being left behind? That's what's coming up. Stay tuned. My name is Josey Mahachi. Welcome to Africa Link, the podcast that connects you to the stories that matter from Africa.
Africa Link, every weekday here on DW.
With over 200 million people and more than 8 million births each year, delivering vaccinations in Nigeria is a critical challenge. Rapid population growth and strong religious resistance, especially in northern Muslim communities, are major barriers. Immunization rates vary wildly from just 6% in the northwest to 44.6% in the southeast. Now, joining me for this discussion is Amina Abdulkarim. She is a health policy analyst and currently leads the Solina Center for International Development and Research, SCIDAR, a leading organization in the field of immunization, primary healthcare PHC, strengthening and research, supporting the introduction of new vaccines in Nigeria. Her work has been instrumental in advancing equitable access to immunization and PHC services, particularly in underserved regions of northern Nigeria, and our own correspondent, Abiodun Jamiu. Let's start with you, Amina, as our expert today, just to begin with giving us a picture of Nigeria's situation regarding vaccinating children.
Yeah, I think, as you stated, Nigeria is a country with like a large population, and our vaccination situation is somewhat dire. We have, just based on Gavi's prioritization of what they call zero-dose children, Nigeria alone accounts for 2.3 million children that have not received any single dose of vaccination. The country also is interested in that the uptake of vaccine has patterns that apply to regions. While we're not like reaching global or even our own national targets, we see better performance in, say, the southern areas compared to the northern areas. And overall, I think the vaccination program is plagued with a lot of like myths, misconceptions, etc., that make it very difficult for people to accept and uptake immunization services. I think a big thing that I feel sort of stymies the uptake of vaccination is the fact that it's preventive. In a country like Nigeria, or a low middle income country where there are more prioritized problems, like with illnesses, curative care is seen as more preferred than things that are preventive. So if it's not broken, why are we bothering ourselves fixing it? But I think, yeah, just to sum it up, the vaccinations ecosystem or landscape is somewhat dire. We have a lot of children that have not received a single dose of vaccine, and there are a number of factors that like affect that, from socioeconomic to cultural myths, etc.
I want to compare what happens in Nigeria with what happens in my own country, Zimbabwe. If you're born in a hospital, your parents give birth to you in a hospital, immediately you're given a yellow card. This is a mother and child card. In this card, there are actually a list of vaccinations. We're talking of polio, we're talking of, different vaccinations that a child should partake or should get from the clinics until you're 5 years old. And this is a must, yeah? This is actually not something that you choose to say, I'm not doing it or whatever, or unless maybe because of religion. And mostly people that believe that this is religious hardly give birth as well in hospitals. They have their own ways. Take us through the process of someone who's being born in a hospital in Nigeria.
Yeah, I think it's about the same. So you're born in
Okay.
a hospital, and through even from your antenatal period, you are told about immunization schedule for your baby and even for yourself, because the pregnant, some of them take this tetanus vaccine. But that system requires that the woman gives birth either in a hospital or through a skilled birth attendant, and that's a an indices that we struggle with as well. Again, better performing in the south than in the northern region, where what we're trying to do is, and I'll speak for the North because that's where a lot of our work happens. And you can imagine it's why it happens because of the disparities in uptake of services. Skilled birth attendant, something where, so it's not even just giving birth in hospitals, at least giving birth with someone that is trained to deliver a child and to be able to sort of improve that and hopefully connect the woman back to the hospital. The initiatives around like training the traditional birth attendants, helping them see that the connection with hospital is not taking away their clients, which is a thing we found, but more trying to save lives of said clients and providing services postpartum after the woman has given birth, providing her access to those services. So I feel like everything is a continuum. Like if you look at continuum of care, that's if you pick maybe the last NDHS survey that was done, I think 2023, and you look at uptake of services from ANC to birth to the first dose of immunization, you will see an almost consistent decline. So more people take up ANC, but then they drop off along the
What
way of
is
ANC. There's even
what is
less
the NC?
antenatal care.
Okay, please break down the terms for some of us who are not in the medical
Oh,
field.
right. I'm so sorry. I'm so sorry. Sometimes we're very tied to our abbreviations. Yeah, but I'll
Yeah,
take note of that.
no
Yeah, so
worries.
there's the antenatal care, and then there is the birth of the child, that's the skilled birth attendant, and then there's the child immunization like schedule. And if you look at the numbers, you'd see an almost consistent decline in how the services are uptaken. So yes, they're solving for immunization and trying to get the children vaccinated, but I think there's also, and it's part of the some of the initiatives I've mentioned around like the training for traditional birth attendants, trying to put a lot more community health workers in communities that are not as skilled as, say, the nurses or midwives, but are able to help connect women and children to health facilities such that there's no drop in that continuum of care from the antenatal care period to delivery up until immunization.
And before I turn to our reporter on ground, Abiodun, Amina, can you just tell us the vaccinations children are supposed to get in Nigeria from birth until they are 5 years old, the names that they're given?
At 6 week points, the child's supposed to get Penta 1, PCV, OPV vaccines are polio vaccines. They're called, that's oral polio vaccine. That's just what it's short for. The Hep B vaccine is really for hepatitis B. And then the BCG vaccine. So these are the three vaccines that are given at birth: BCG, OPV, and Hep B. The BCG one is something called Bacillus calmette-guerin, and it's supposed to help with like TB and a number of infections for children. So those are the three given at birth. When you come to the 6 week period, you still get another dose of OPV. They call this OPV1. You get IPV. It is still a polio vaccine, but this one is injectable. So unlike OPV that's oral, you get like an injectable polio vaccine. But you also get PCV vaccine, which is one that helps protect against things like streptococcus, pneumonia, etc. And then you get Penta. Penta is a suite of 5 vaccines combined together that treats things like diphtheria, tetanus, pertussis. It also has hepatitis B and has something for influenza.
Yeah, okay. Well, I'm learning, I'm learning, not for children, but maybe grandchildren. I don't know. But now turning to Abiodun, our reporter on the ground, as you're reporting in regards to this vaccination challenge in Nigeria, what kind of challenges has the media been experiencing, especially reporting on this issue? Are parents mothers willing to talk to reporters?
Yeah, Josey, thank you. Earlier this year, DW did a report that I authored on immunization and vaccination in northern Nigeria. And while we were on the field talking to mothers, and even fathers, we were able to understand some of the challenges they face. Particularly, we see pockets of vaccine hesitancy and misinformation, especially in northern Nigeria. Just like Amina said, that there's disparity between the South and the North. So basically, most of our reporting are usually in the North, and most of the challenges people report are also from the North. So in the North, we have no religious belief, cultural misconceptions, and misinformation, have fueled skepticisms among mothers and fathers. And in fact, there was a mother that told me that she was asked not to take her baby to primary health care for vaccination because it causes infertility. So imagine those kind of misconceptions. And we have husbands that will not allow their wives to take their babies for vaccinations, especially after the Penta. Some of them told us that when their baby take the Penta vaccine, they experience headache and high temperature. And in some extent, the husband usually complain about the cries and the noise. So some of them, these are some of the challenges they reported. Also in the North, we have a raging insecurity and conflict that has prevented healthcare workers from accessing certain communities. For instance, a report that we have in Katsina said that we have about 64 primary healthcare facilities that have been shut down in Katsina. We have the same issue in Zamfara, and we have the same issues in Sokoto, where we have boundary issues. Similar in the Northeast, where we have the Boko Haram insurgency. So this means that there are some communities that are inaccessible for healthcare workers and even for these mothers to come out. For instance, now in Sokoto or in Katsina, Zamfara, in these communities, it will be very hard for people or young mothers to go to the nearest facilities to take their baby for vaccination because they don't know what will happen along the road. They might be kidnapped, they might be abducted or killed in the process. So most of them stay away from coming out. We also have healthcare workers are unable to access these communities because it's a total cut-off. They don't know what will happen along the way, going there and coming out. So these are some of the challenges. We also have cases of the supply chain issues where communities are unable to store or properly store this vaccine before they expire because the cold chain failure is also there. So
and the electricity,
as a result of electricity. So these are some of the issues that people are reporting and we've seen on the ground when we're covering vaccination in northern Nigeria.
But despite significant investments in the immunization program, Nigeria's vaccination coverage has remained below predetermined levels, Abiodun, which international health organizations set to ensure herd immunity. Why, though? Is it the same reason that you've just given in regards to why parents do not allow their children to get this vaccination?
Yeah, in addition to the previous factors or reasons that I gave, there are still issues of funding. Although there are substantial investments from international partners like Gavi, UNICEF, we also have non-profits or NGO, that, as we used to call them, that are putting in some effort to boost vaccination coverage. For instance, in the story that we did earlier this year, we look at how a particular non-profit is using cash incentive to encourage vaccination in northern Nigeria, where they give mothers some certain amount of money to cover transportation and loss of income. So these are some kind of investment but personally, when you look at it holistically, you realize that there have not been enough funding from the Nigerian government regarding some of these things. A lot of funding for vaccination and immunization are mostly through international funding and efforts of NGOs. At the moment, it's even there at the moment because of the current funding freeze from the US or the Trump, because of the funding freeze from US. So it's become even there to fund some of these programs. Not even to talk about vaccination alone. There are issues like family plan that have seen drastic cuts and also immunization. So we also have infrastructural barriers like rural and hard-to-reach communities. Just like I said earlier on, that we have insecurity, but still there is still lack of access to health care in some communities. We see some communities, some rural, cases of low intake of vaccination mostly occur in rural communities. So because this is where we have pocket of hesitancy, we have misinformation that thrive even from religious leaders, but we also know that lack of access to health care in this area, some of them are not functional. So you see dilapidated buildings, outside primary healthcare centers, and we also have poor road network to this area to facilitate outreach and sensitization to this community. So these are some of the challenges that are still affecting vaccination in Nigeria, in addition to the one I mentioned earlier on.
Let's go back to Amina, the expert. Amina, I don't know if you want to add anything on that.
Oh, okay. I'll speak to the, big buckets and then speak to what's been done and what gaps still remains, right? So I think one of the barriers that we have, or one of the challenges that we have, is funding. As Abiodun rightly stated, the bulk of our vaccination, particularly procurement of vaccines, is funded through Gavi. And there's a co-financing arrangement that ensures that the government takes up full funding after a number of years. But as it is now, it's still a co-finance agreement. So that means Gavi puts in some money, UNICEF as well puts in some money, and then the government of Nigeria puts in some money, and then we procure vaccines. This funding support also supports some infrastructure, particularly cold chain. So in their health facilities or primary healthcare centers, one in each ward in the country, that is called an Apex Health Facility or the main ward PHC. And these PHCs are equipped with solar-powered cold chain equipment to maintain the potency of vaccines. This is available. I think I can speak for states where I work in, where I have seen said cold chain equipment. So in a lot of the states in the north, we have this cold chain infrastructure, solar-powered, available in one PHC per ward. And the thinking for that is it helps if you're able to store it at that point. For health facilities that are not equipped, they go to this health facility to pool. They call it like a pool system. So you go, you get vaccines for your sessions, right? And then you return whatever is left. Now, in terms of what is missing in the funding gap, beyond the procurement of vaccines, there is a lot that goes into vaccine delivery that's around implementation, that requires things around the HRH for the remuneration for the staffing, but also logistics for what we call outreach sessions. And these are sessions that happen within communities. So there are, I don't know if I should go into, so there are three types of sessions. There are fixed sessions. These are for communities within a 2-kilometer radius from the health facility. The expectation is clients in these households within 2 kilometers from the health facility can walk to the health facility to get services. And so in developing a schedule, they are penned down for fixed sessions. For outreaches, however, these are households within 2 to 5 kilometers from a health facility. And for these settlements to be able to manage the challenge around like paying for transport by the clients, etc., the health worker goes to the community, sets up in a particular point agreed on with the traditional leader and some community leaders that this is the point for vaccination on XX day, provide vaccination in that community. And then for mobile, this is more for households outside of 5-kilometer radius from a health facility. And the health worker essentially is expected ideally to go house to house to visit, because in these mobile areas, the expectation is that it's very far from a service point, and the assumption is that the houses are a little more dispersed and requires the health worker to move house to house. For this to work, as you can imagine, there's something they call real microplan that maps each health facility and these radius differences, and each primary healthcare center has this. But as I said, the challenge is with implementation.
Abiodun, the word funding is what I kept hearing from Amina, meaning that there are many organizations, even international organizations, bringing funding to this, but we still see that the healthcare system in Nigeria is still dilapidated, lack of healthcare workers. I'm just wondering what the problem really could be. Is it a matter of corruption? And I also heard that northern regions face unique challenges also, obviously, due to insecurity and conflict, which, yes, we know hinders vaccination. So what kind of stories are you also hearing when you report from the health workers?
There's this lack of political will, just like Amina said, that most of this funding from the international donor are still co-signed with Nigerian government. So we have cases of corruption and inefficiency especially reported in the media, where we have mismanagement of immunization funds and inflated procurement costs, which diverted resources meant for outreach and cold chain systems. So these are some of the problems that we are still facing in the north, particularly as it has to do with the political will. And most likely, we are also looking at the national government at the subnational level. There's a lot going on with regards to immunization efforts. And for instance, in Sokoto, I know that some of their programs are still funded heavily by the international donors. So there's little to no political will or commitment for subnational government to also chip into funding immunization campaigns and vaccination programs in the region.
Amina, as we wrap up our discussion, like most African countries, Nigeria is also chronically short of health workers and the healthcare system is dilapidated. What advice would you give to governments, especially to at least improve the situation in terms of health?
Yeah, I think as it relates to health workers and sort of optimizing that, I feel like there are some opportunities, and it goes back to funding. A lot of especially at subnational level, they have a number of partners, as he even mentioned. In Sokoto, for example, there's a lot of partners working on immunization. The unfortunate thing is everybody sees their program as their own in a way, and so it sort of runs parallel and sometimes towards achieving the same objective. What might be easier, or what I might advise, is some sort of pooling of funds by these different partners, such that we are not replicating. Because a lot of the time, what we're doing is like we're implementing like outreaches, etc. But if we pool the funding with the amount that is being pushed into immunization, I feel like there can be better ways to optimize it. And since it's the partners managing it, there would be some additional layer of accountability and sort of visibility that you would have that you might not have with government fund, just because government is not it's not a private entity essentially. And these funds can then be funneled towards like paying for health workers stipends, paying these volunteer workers, etc., as a way to alleviate the burden, as it were, from the governments and contribute in ways that I feel would be a lot more meaningful. I know Gavi is trying to do that. There's some pot of fund they're trying to create for human resource. Let's see how that pans out. But I feel like that's a thing that we might figure out how to pull funds and then optimally allocate funds to the actual problems rather than us just like running our own independent rodent wheels to achieve the same objective. I know that the southern states seem to be doing better, but I feel like with COVID-19 and the vaccine and the anti-vaxxer, whatever that came up after that, there is a lot more. We will see some decline in southern areas. With the HPV vaccine, for example, Lagos State had the least uptake. So while we are solving like the northern problem, I feel like it would be good for us to shout out and not take for granted the southern region and start to solve the problem before it gets worse. Over.
Right. Amina Abdulkarim, a health policy analyst and currently leads Solina Center for International Development and Research portfolio on immunization. And DW's Abiodun. Jamiu, thank you so much for joining us. At the Africa Link podcast, we always look across the continent to see how the stories we are dealing with play out or at times even overlap. Sierra Leone made significant progress in vaccinations, particularly Mpox. A decade ago, Sierra Leone was one of the countries worst affected by an Ebola epidemic, which between 2014 and 2016 killed about 4,000 people, including nearly 7% of health workers. But now the government has opened 4 treatment centers in the capital since February. Austin Dembai, Minister of Health and Sanitation of Sierra Leone, explains.
Today, Sierra Leone proudly stands as a beacon of progress in the fight for equitable vaccine access. Our national immunization coverage has consistently improved, and we have made significant gains in reducing childhood mortality and preventing vaccine-preventable diseases.
And as we speak in this particular point in time, Mpox vaccination is going on in the field. And we have to also acknowledge the immense contributions of Gavi in terms of making these vaccines available, and if through the gracious finances that are made disposable to the government of Sierra Leone and we, the partners that are working to translate this vision into results.
You've been hearing from Sierra Leone's Health and Sanitation Minister telling us how Sierra Leone has attempted to ensure that children are vaccinated. One can only hope that other countries, including Nigeria, can borrow a leaf. That's it for this edition of Africa Link. Remember, you are not just a listener, but a vital part of our community, and your engagement can shape the direction of our discussions. We value your insights and encourage you to share your thoughts with us. You can find all of the Africa Link podcast episodes on Spotify and Apple, or wherever you listen to your podcasts from. This episode was co-produced and edited by Isaac Mugabi. My name is Josey Mahachi. Thanks for listening. Until the next one, it's bye for now.
DW News.
Here are today's top news happenings and why they matter. Pope Leo XIV has celebrated his first Mass a day after becoming the first U.S. head of Catholic Church, with the world watching for signs of what kind of a pope he will be. So what are people saying about this new spiritual leader to the world's 1.4 billion Catholics? Let's begin with some world leaders.